Welcome to my channel RX Sam 2020. Today we discuss a drug named Telmisartan. About Telmisartan is an angiotensin receptor blocker, ARB. It may be used for the management of hypertension, alone or in combination with other antihypertensive agents. Medical use. Telmisartan is used in hypertension, cardiovascular risk reduction, and diabetic kidney disease. What is high blood pressure, hypertension? Blood pressure is the force in your blood vessels when your heart beats and when your heart rests. You have high blood pressure when the force is too much. Telmisartan tablets can help your blood vessels relax so your blood pressure is lower. High blood pressure makes the heart work harder to pump blood throughout the body and causes damage to the blood vessels. If high blood pressure is not treated, it can lead to stroke, heart attack, heart failure, kidney failure, and vision problems. Cardiovascular risk. Patients older than 55 years of age who have been diagnosed with blood vessel disease in the heart, legs, or brain, coronary, peripheral, or cerebral vascular disease, or diabetes with end organ damage, for example kidney, compassion, and brain, are at higher risk of cardiovascular events, for example death from cardiovascular causes, stroke, and heart attack. Contraindications. Telmisartan is contraindicated during pregnancy. Like other drugs affecting the renin-angiotensin system, RAS, the renin-angiotensin system, RAS, or renin-angiotensin-aldosterone system, RAAS, is a hormone system that regulates blood pressure, fluid and electrolyte balance, and systemic vascular resistance. Telmisartan can cause birth defects, stillbirths. A stillbirth is the death or loss of a baby before or during delivery, and neonatal deaths. It is not known whether the drug passes into breast milk. Also, it is contraindicated in bilateral renal artery stenosis. In renal artery stenosis, one or both of the arteries leading to the kidneys becomes narrowed, preventing adequate blood flow to the kidneys, which it can cause kidney failure. Special precautions. Patients with aortic or mitral stenosis, mitral valve stenosis, sometimes called mitral stenosis, it is a narrowing of the valve between the two left heart chambers. Obstructive hypertrophic cardiomyopathy, HCM, is a disease that involves the thickening of your heart muscle. Ischemic cardiopathy. It's heart problems caused by narrowed heart arteries. Ascites due to cirrhosis, refractory ascites. Refractory ascites is defined as ascites that do not recede or that recur shortly after therapeutic paracentesis, despite sodium restriction and diuretic treatment, and patients undergoing major surgery or during anesthesia. Monitoring parameters. Monitor blood pressure regularly, serum creatinine, electrolyte levels, for example serum potassium, and blood urea nitrogen. Assess pregnancy status and signs of angioedema. Drug interactions. Due to its mechanism of action, telmisartan increases blood potassium levels. Combination with potassium preparations or potassium-sparing diuretics could cause hyperkalemia, excessive potassium levels. Combination with NSAIDs, nonsteroidal anti-inflammatory drugs, especially in patients with impaired kidney function, has a risk of causing, usually reversible, kidney failure. Digoxin, warfarin. Side effects are similar to other angiotensin II receptor antagonists and include tachycardia. Tachycardia is the medical term for a heart rate over 100 beats a minute, and bradycardia. Bradycardia is a condition where your heart beats more slowly than expected, under 60 beats per minute. Hypertension, low blood pressure, and edema, swelling of arms, legs, lips, tongue, or throat, the latter leading to breathing problems. Allergic reactions may also occur. Painful urination or changes in urinary frequency. Brand names that are mostly prescribed by doctors: Actelsar, Micardis, Preta, Twynsta, Telma. Dosage may be taken with or without food. Hypertension, oral, adult, initially 40 mg once daily, may be adjusted to 20 to 80 mg once daily according to clinical response. Maximum 80 mg once daily. Renal impairment, severe or on hemodialysis, initially 20 mg once daily. Hepatic impairment, mild to moderate, maximum 40 mg once daily. Severe, contraindicated. Cardiovascular risk reduction, oral. Adult, 80 mg once daily. Renal impairment, severe or on hemodialysis, initially 20 mg once daily. Hepatic impairment, mild to moderate, maximum 40 mg once daily. Severe, contraindicated. Warnings. When used in pregnancy, drugs that act directly on the renin-angiotensin system can cause injury and even death to the developing fetus. When pregnancy is detected, telmisartan tablets should be discontinued as soon as possible. What foods should be avoided while taking this medicine? Potassium supplements, potassium-containing salt substitutes, no salt, Morton salt substitute, and others, and even high potassium foods should be avoided by those taking telmisartan. Do not drink alcohol while taking this medication. Drinking alcohol while taking this medication increases the risk of dangerously low blood pressure and causes adverse effects such as dizziness, fainting, lightheadedness, or headache. Frequently asked question: why do people with telmisartan need hydrochlorothiazide or chlorthalidone, diuretics? Side effects of telmisartan include edema, swelling of arms, legs, lips, tongue. Hydrochlorothiazide and chlorthalidone both are diuretics, a type of medication that causes the kidneys to excrete more water and sodium, which can reduce edema. Combinations. Telmisartan plus hydrochlorothiazide. It lowers blood pressure effectively. Telmisartan is an angiotensin receptor blocker, ARB. It works by blocking the hormone angiotensin, thereby relaxing the blood vessels. This allows the blood to flow more smoothly and the heart to pump more efficient. Hydrochlorothiazide is a diuretic that removes extra water and certain electrolytes from the body. Over time, it also relaxes blood vessels and improves blood flow. Telmisartan plus chlorthalidone, same as telmisartan para 1 with chlorthalidone, is a diuretic that removes extra water and certain electrolytes from the body. Over time, it also relaxes blood vessels and improves blood flow. Telmisartan plus cilnidipine, same as telmisartan para 1, with cilnidipine is a calcium channel blocker, CCB. They work by relaxing the blood vessels and making the heart more efficient at pumping blood throughout the body. Telmisartan plus amlodipine, same as telmisartan para 1, with amlodipine. Together they work by relaxing the blood vessels and making the heart more efficient at pumping blood throughout the body. Together, they lower blood pressure effectively. Telmisartan plus chlorthalidone and metoprolol succinate. Telmisartan lowers blood pressure effectively. Chlorthalidone is a diuretic that removes extra water and certain electrolytes from the body through urine. Over time, it also works by relaxing blood vessels and improving blood flow. Metoprolol succinate is a beta blocker that works specifically on the heart to slow down the heart rate, while telmisartan is a calcium channel blocker that works by blocking the hormone angiotensin to further relax blood vessels. Mechanism of actions. Telmisartan interferes with the binding of angiotensin to the angiotensin 281 receptor by binding reversibly and selectively to the receptors in vascular smooth muscle and the adrenal gland. As angiotensin 2 is a vasoconstrictor, which also stimulates the synthesis and release of aldosterone, blockage of the results of its effects decreases systemic vascular resistance. Telmisartan does not inhibit the angiotensin-converting enzyme, other hormone receptors, or ion channels. Studies also suggest that telmisartan is a partial agonist of PPAR-gamma, peroxisome proliferate activated receptor, which is an established target for antidiabetic drugs. This suggests that telmisartan can improve carbohydrate and lipid metabolism, as well as control insulin resistance without causing the side effects that are associated with full PPAR-gamma activators. Thank you for watching. Please like and subscribe to my channel and click the bell icon to get video updates.